All right, today I'm going to show you what we do with stiff and painful wrists in the clinic, especially those ones who have pain when you are loading the wrist. So when that wrist or hand goes backwards into extension like that and they get pain inside the wrist and the carpus there, there's a lot of stiffness there, I'm going to show you what mobilizations we do today, plus what sort of self-help and stretches and exercises you can do at home. Now maybe you're one of those people who actually just gets pain from doing push-ups or in that sort of pressing position. Maybe you can't get on all fours and go on there. You've always had problems trying to get that sort of range. Maybe you've fractured your wrist or your hand and you've been in a cast for like 6 weeks and it's really stiff. Or if you've sprained, say, that TSCC ligament or sprained something in the wrist like a ligament and you've been in one of these wrist braces for too long, then sometimes your wrist can get really sore and you actually lose the range going there. You can also lose range going to flexion. Now, what we do in the clinic is mobilize the joints in the carpus and the wrist to try and increase the range. We start gliding that wrist to try and get it better, and then we go through some homework. So for this sort of thing, what I like doing is mobilizing individual carpal bones as well as the whole wrist. Now, to get the whole wrist done, I block them up on here, and we do two sort of things. One, we want to aim for going into extension, like to get that moving better. So we're going to do a mobilization to get that better. We're also going to do a mobilization to get the flexion better. Now, the extension is the easier one to do, and it's usually the most problematic one because that involves people putting their hand on something or pushing off something. That one, we go for a PA. So remember, anatomically, a PA is that way, so the wrist going that way and the hand coming this way. So we go for the radius and ulnar right on the head part there, and I'm blocking with this finger, the actual carpus. I can sort of feel her pisiform there and getting into the sort of scaphoid sort of reason hamate there and holding it there, and then gliding down. Now if you imagine where that wrist sort of like, not that it's a pure line through there, but you can see where the crease line is. You imagine where, okay, where's she going to crease there? That's where I want to be sort of away from. So the crease line's in the middle of my two sort of hands there. So when I glide down, I'm going to try and get a vertical movement down that way. Okay, so I'm actually sort of shifting the bones like that, okay, in a vertical direction. I'm not jamming them together. We're trying to go for a complete glide through there. Now the reason for that is when you move your wrist, there's a slide, glide, sort of roll mechanism through that wrist. And if that is stiff in there, there'll be a point where the joint just stops and jams because there's not enough movement going through. So that's why we go for the movement here. Now, sometimes people get a bit sensitive with their wrists. They've been sore for a few weeks. I tend to pad that out to try and soften out my grip on that and get in there and just carefully traction that wrist first. So that's another thing you can try and do is you traction it that way and then just glide it down here. Now with very, very stiff wrists, you'll find there's hardly any movement. You just got to be careful how sore that is. But I'll be doing quite a lot of reps and sets. You okay with that, Claire? Quite a lot of reps and sets with this to try and find that person's sort of normal movement in range, just feeling for those tissues, and you'll find that that'll start loosening up pretty quick. You might have to do it for a good sort of 10-15 minutes and just doing repetitions like maybe 10, 15, 20 reps per set. You feel that clunk now? Every now and again you'll get a bit of a clunk going through as that starts loosening up and I really start getting some movement and the actual bones not dislocate, but we sort of sublux them a little bit, and that's fine because that's what the wrist can do because it's a nice mobile joint. There'll be a point where it really opens up and you get some decent sort of clunking going on there. Now, if it is very stiff, then it's starting to loosen up, you'll get quite a bit of noise, a bit of movement, and then as it really loosens up, that will probably settle down as that movement improves. Now, that's just basic PA movement to help with the general movement of extension to that wrist there. Okay, so it's very basic, very broad, generalized movement, has to be done. You can also be very specific if you want to. So if assessment-wise, if that wrist is stiffer on one side, you can then go over, say, to the radius and just work on one side. Okay, so I could just work on her radiocarpal joint. You can see I can do much more movement with that one, right? So I can block her here and just get into that movement there. You can see I can play with her wrist quite a bit. She has got stiff wrists because, hey, she's a physio, so she's going to have some stiff wrists, right? But I can really play with that movement there. Is that sore? And you can feel that clunking going on there. Now, the good thing about that is it's designed to do that. You can stretch that tissue out, and that'll give her so much more freedom of movement. She'll still have the control. It's not going to make her wrist hypermobile or anything like that. If anything, it's taking away the stiffness, so it's getting back to normal. It'll feel weird for them. They'll sort of go, what is going on with my wrist? But the more you get used to it, the more you do, see that clunking settled already, is that actually sort of comes back to a normal movement. So that's one way of doing it. You can then go back and put some weight through the ulnar and start getting some movement there. And then you'll probably find every time you retest that, there'll be a bit more movement into extension that way. Okay, so a bit more movement, a bit less pain, and also probably less pain through range. When they get to the end range, there might be less pain there too. So that's to try and improve that movement there. Now, if you've got carpal stiffness in there as well, so meaning the carpal bones feel stiff, you're losing some range in there, you can start getting into each individual one and try and improve your movement down through. Now, you'll probably find that capitate is probably the one that is going to be the stiffest. It's the most common one, but you can start playing around with some of these to improve how well they individually move in there. Again, sometimes it's a bit broad. If your thumbs are quite big, their bones are quite small, you're probably going to hit 2 joints at one time, but you can be generalized and specific as much as you can with these. This one, you'll have to play around quite a bit and get really good feel for that person's wrist and find out where their sore spots are. Be very careful of things like ganglions and cysts in there, because they can be in there. You pushing on those are going to be a bit sore. So you'll have to have a good assessment of their wrist and make sure that there's nothing like that going on. Maybe they need a scan on that. But if it's a generalized stiffness or post-operative, post-fracture, post-sprain that they've been so stiff with, then you can probably safely get stuck in there and just generally loosen up all those ones. Just going through each one of those bones you can find there and work out where the stiff ones are. And you'll find there'll be a point, there'll be a common theme there. There's the stiff one, work on that. Now, the first thing I do is I'm sort of holding and blocking at the back of the wrist, and you're just going through a PA with that, just very generalized. When that loosens up, then you'll see, as that range loosening up, to get the end range, to get this really sort of in range movement, because some people might need that. They might be doing push-ups, might be doing loaded pressing work. That movement, then you can start doing what we call an MWM. So that's a movement with mobilization. So this one, I would actually work on a bit of traction as well. So I'm going to sort of grab one carpal bone and push it into a PA while I do extension. So from here, I'll traction her out, push it down, and then watch her face and make sure when I push through that, she's not getting too sore, and then coming out. Now, sometimes these clunk around as well, but this is a really nice one to individually get a bit of movement through there. So that pressure through there, and then going into extension. Again, you'll be a bit limited depending on how big your thumbs are. You might get to the point where I can't go any further, because as that wrist closes, you sort of disappear those joints and you can't get to them. So you've really got to work in maybe a bit of flexion to start with, and then glide it through from flexion through to neutral, and then maybe a little bit of extension and really get in there. Some people's wrists, they're sort of not too sensitive, and you can really stretch in there and get into that wrist and loosen it up. There's a few clunks in there. And you'll find that, working on that, it'll come down to 1, maybe 2 little culprits that are the stiffest part, and that movement there you can really start focusing on. And that may take a few sessions to get looser and better, but again, retest that every time to try and get that extension. Now that's going backwards, going to wrist extension. Obviously the most important one, the flexion can also be a problem as well. Now with the flexion one, what I tend to do is just flip that over. Okay, now this is a little bit harder. You'll find getting in here is a little bit harder. What you can do though is to do the PA that way, all right? Or you do it the opposite. Okay, so you're doing a PA that way. Okay, so PA of the wrist on the carpus. So if you imagine they're trying to go this way, all right, so I'm doing a movement where I'm blocking the actual radial ulnar this time and PAing that way. And you can do it in different degrees of flexion as well, which really helps. But if you're going to come to the carpal ones, here what I tend to do is mostly an MWM with these, because you'll find that you need to sort of push through into flexion like that. And they're usually a lot more tolerable. I find that these ones are less sensitive, less sore than going that way, all right? And it is a less common problem of flexion, being able to, you know, have problems there. In saying that, a lot of people feel like, oh, my wrist is really tight. It's very easy to stretch that out though. So if they've got tightness into wrist flexion, they can go and start stretching that out. And it's, you know, a lot of the time that fixes the problem without you having to mobilize. But if that joint has had damage, or there's been some spraining and bleeding through there with some tightness in the tissues, that's where you'll have to probably get in there and individually find those stiff areas and mobilize them for them, because this generalized stretch is just not, it's too broad, it's not enough. They need to be able to, you know, have someone get in there and loosen that up and work away on trying to stretch that out and get all those joints moving individually, so when they do go and then stretch, the whole thing's better. Okay, so that's your mobilization work, just of the wrist. Let's work on some stretches.